Okay, good afternoon, everyone, and welcome to the Delaware Center for Clinical and Translational Research Tech Talk. I am Mia Pappas, the site PI Christiana Care for the Delaware CTR, and our Chief Scientific Officer for the Institute for Research on Equity and Community Health, or IREACH. Before we get to our talk this afternoon, I have two announcements. First, CME credit, 1 credit, is available for attendance at this Tech Talk. If you did not RSVP to Deborah Reese for this presentation, feel free to email Deborah to obtain the information for the CME educational credit. Her email will show in the chat box momentarily. Thank you very much, Deborah. Now, it is my absolute pleasure to introduce Dr. Zugui Zhang. Dr. Zhang is the Director of Biostatistics at IREACH, or Christiana Care, and he recently celebrated his 15-year anniversary with us. He is a fellow of the American Heart Association, an affiliated professor of the University of Delaware. He's a guest professor at Jinan University in Guangzhou, China, and he is faculty of medicine at Thomas Jefferson University. He received his master's degree in statistics from Arizona State University, his PhD in biostatistics from the University of Iowa. Dr. Zhang has received numerous awards and honors, has over 90 publications, and has presented his work to audiences all over the world. He has worked extensively on large international, multi-center randomized clinical trials, as well as large and small observational studies. Dr. Zhang is also a very patient, thoughtful teacher who can break down complex statistical concepts for lay audiences and has provided trainings on numerous statistical concepts, both internally to Christiana Care and to national audiences. I am delighted that Dr. Zhang has agreed to speak with us this afternoon, where he will be presenting an introduction to mediation analysis. Zugui, take it away.
Thank you very much, Mia, for your very nice introduction. Good afternoon. I'm very glad today talk about introduction to mediation analysis. Mediation analysis has become more and more important in medical-related studies. So in today's talk, I'm going to first talk about mediators and the mediation analysis. I will outline the statistical mediation analysis framework process. I will provide the framework of mediation analysis specifically for how to conduct a mediation analysis with statistical tests and related results. As usual, I will use my first-hand examples in medical-related research to illustrate the mediation analysis.
Excuse me, Zugui, could you share your screen? We don't see your slide.
Oh.
Up at the very top, share screen.
Now, can you see my screen?
Excellent. Yes. Thank you.
Today, I'm going to talk about the introduction to mediation analysis. The purpose of today's presentation is to introduce mediators and mediation analysis. I will outline the statistical mediation analysis and also examine the framework of the mediation analysis, including how to conduct some related tests to test the effects of mediators. As usual, I will use my first-hand studies to illustrate how we can perform mediation analysis in medical-related studies. When we talk about mediation analysis, the first concept is about a mediator. A mediator in terms of statistics, is just a variable that is intermediate in the causal process, relating independent to a dependent variable. For example, if we are going to study a quality of life in cardiovascular disease, we will see the relationship between physical activity and some outcome in cardiovascular disease, such as like MI. So as we know, the physical activity program can improve BMI, which is body mass index, and also the BMI have impact on MI. So we would like to say if the BMI can be like a mediator, which means physical activity program improve BMI, and the BMI impact MI. So we can say BMI could be like a potential mediator. Another example is like tobacco prevention program can change like anti-tobacco status, which will reduce tobacco use. So we would like to say if our effort in tobacco prevention program can like impact the anti-tobacco norms and eventually can reduce tobacco usage in some certain of population. In our Christiana care, we have a lung cancer early screening program. So the purpose of the lung cancer early screening is to improve the identification of early stage lung cancer. And of course, the early stage lung cancer can significantly reduce the lung cancer death in the end. So we would like to say our lung cancer early screening program to like increase the identification of early stage lung cancer and eventually reduce lung cancer deaths. So we can say the identification of early stage lung cancer could be like a very important mediator. So which means it's a mediator means between the early screening program as a exposure or treatment to the final outcome, which is lung cancer death. So as we can say, the purpose of mediator or mediator analysis is to examine if and to which extent the effect of an interesting variable. Usually, it's like a treatment or like the exposure on an outcome variable is mediated through a variable M. M is just the mediator. So, if we now outline the framework of mediation analysis, we need to introduce some notations. We let TI be a variable of interest, usually just like a treatment or a specific unit or subject I. And then the important is MIT be the potential value of a mediator of interest for unit I and the treatment status. So here we let T equals 1 for the treatment, and we let T equals 0 as either like a placebo group or standard group. And we let YI related to the treatment, related to the mediator, denote the potential outcome if the treatment and the mediator variable equal to T and M respectively, so that we can consider the observed outcome, which YI is a function of the treatment and the mediator. And the MITI is the observed value of the mediator. So our outcome related to treatment and also related to mediator. In addition, we can adjust with other variables such as like age, gender, which are the observed pre-treatment confounders for the subject or unit I. So in addition to treatment and the mediator, we can adjust the other observed pre-treatment confounders or variables incorporated in the model. So the diagram or mediation analysis related to outcome, related to variable of interest such as treatment or exposure, related to potential mediator, and also related to other independent variable. That could be like one variable, could be like multiple variables. So here is the diagram, and we can see that this is like a triangle. We have treatment, is like the one point. We have the mediator, is another vertex, and eventually we have outcomes. From treatment to mediator, we could have other variables. From a mediator to outcome, we could have other variables. And of course, from a treatment directly to the outcome, we could adjust it by other variables. So this is a diagram of mediation analysis. And then after doing that, we can examine the mediation effects. First, we can have the total unit treatment effects. That could be like the difference between the outcome with treatment, with mediator, and the outcome without treatment and without mediator. This is like a total unit treatment. And then we can decompose those total treatment effects into several parts. The first is quasi-mediation effects, which means we can consider with this treatment, but with or without this treatment. And the second is all other causal mechanisms. This is we consider the mediators, but we will see with or without treatment. And then we can get the total effect that will be defined by tau I is just like the causal mediation with or without treatment. So we have a total treatment effect, we have a causal mediation effect, we have other causal mechanism and a total effect. Now, let's look at how we can figure out the different effects. The total unit treatment effect can be written as tau I equals the outcome with treatment with mediator, and then minus the outcome without the treatment and without the mediator. The effect can be decomposed into two important components. One is ACME, which stands for the average causal mediation effects, the population average of the causal mediation. Another is the average direct effects, ADE, the population average of the direct effects. Now we will look at how we can use a statistical regression model to decompose it and to figure out the different effects. First, we have the regression. This is the outcome Y as a function of a variable interests like treatment and the other variables without mediator. In this plot, which is just use this red color from treatment plus other variables, but without mediator, we will look at the outcome Y. So this is our first regression model. The second regression model is the potential mediator M is regressed on the variable of interest T and adjusted by other variable X. So here is our second regression model. See here, we can look at the light purple path from the treatment to mediator, which means mediator regressed on the treatment and the other variables. So after the first two regression equation, we will have the third analysis involves regressing the outcome Y, the interest variable treatment T, potential mediator M, adjusted by other variable. So this is our third function. So we can say this is a like include treatment, include a mediator, and also include other adjusted or confounders. After we run this 3 regression model, we will get the 3 steps, 3 models. Even though we have 3 regression models, but every step is manageable, which means not so complicated or not so difficult. So we have equation 1, 2, and 3, and then we have the corresponding plots to show the 3 steps, 3 models. I would like to point out, in the 3 models or the 3 equations, the one outcome not only can be like a continuous outcome, dichotomous outcome could also have like other format, such as like the count data or even survival data. So that these 3 steps, 3 models can be widely used for a variety of statistical issues. So this is the basic framework of mediation analysis. And then we will have this mediation analysis pathway. This is corresponding to the 3 equations. Okay, so we'll in the mediation analysis, we will have some terminology or jargon like the path C, path A, and the path B, and C prime. And here is like A, B, C, and C prime stands for what kind of a path. So this is not only basic for us to understand the process of mediation analysis, but also important for us to understand some outcomes and output from statistical software, such as from Stata and others. So here we have path C. Path C use the red order without mediators. And part C prime use the light green indicate this model with mediator. And then path A stands for the mediator regress on the treatment and other variables, and so on. So this mediation analysis path is the paths are very important and basic for us to understand the terminology in mediation analysis. And also, this is the way for some statistical software, such as like Stata, to illustrate the outcomes. And then we will have a mediated, direct, and total effects. The mediated effects is just like A times B, A, B, C, and C prime is the corresponding results I just mentioned in this slide. And we have mediation effect C minus C prime, difference in coefficient. Mediated effect or indirect effect is A times B is just the C minus C prime. And we have a direct effect is C prime. The total effect will be A times B plus C prime. This is like from path C. In linear or generalized linear system, the total effect is equal to the sum of direct and indirect. But as I mentioned, our 3 paths, our 3 models cannot only used for like a continuous variable or something like that. Also can be used for like count data, like survival data. So that models can be used for nonlinear models. If we fit for the nonlinear models, the total effect is not generally equal to the sum of the direct and the indirect effects, but to a modified combination of 2. So that we need to like do some modification of the effects. Okay, after we conduct the mediation analysis, the purpose for us is to see if the mediation effect is statistically significant or not. As many other statistics, we need to have formal mathematical solid tests for the mediation effect. Usually, we have 3 tests for significance of mediation effects based upon the product of the coefficient of the models, estimates of coefficients, the A hat, B hat, and their corresponding standard errors. These tests include like a Sorbo mediation test. This is a test that statistics use the formula here. And also there are some modified mediation tests, Goodman 1 and Goodman 2 tests. So we need to use those, we need to use the Sorbo mediation tests and the others to statistically test the mediation tests. When we look at the mediation effect, for each method of estimating the effect, based upon the equation 1, 2, and 3, C minus C prime, or equation 2 and 3, A and B, this is like the reliable and valid measures. Coefficients A, B, C prime reflect the true causal relations and the correction function norm, no orbit influence. The mediation chain is correct, temporal order is correct T before the mediator, before the outcomes. Homogeneous effects across subgroups, it is assumed that the relation from treatment to mediator and from the mediator to outcome are homogeneous across subgroups or other characteristics of participants in the study. So when we conduct the analysis, we need to consider those mediator effects. We need to estimate the product of coefficients estimation of the mediate effects AB and the standard error. That the most general approach with the best statistical purpose. Best tests are the joint significance distribution of products and bootstrap for confidence limitation estimation and significance tests. These are the statistical way for us to conduct the mediation analysis. And we will see when we conduct a mediation analysis, whether the overall effect of treatment on outcome is significantly or not. It is possible to obtain a non-significant overall effect of treatment on outcome, but statistically significant mediation. Mediation analysis also provides information about manipulative theory, treatment on mediator and conceptual theory. So we will do this kind of analysis. If we ignore this kind of analysis, maybe it can have some misleading about the non-significant effect of treatment on outcomes. So basically, we talked about if we have one mediator. Further, if we have multiple mediators, we can also conduct an analysis such as this parallel multiple mediator models. For example, we could have mediator 1 and mediator 2, and then we can conduct the parallel multiple mediator analysis. When we conduct the multiple mediator analysis, we will have the test for the mediator effects, standard error, total mediator effects, direct effect C prime, and also we can conduct the Sorbo mediation test based upon the total effects. Okay, now I'm going to use some my first-hand examples to illustrate how we can conduct the mediation analysis. First, I'm going to talk about a project from the University of Delaware. This is a project about cognitive and brain pathology. A preliminary cross-sectional study of community joined older adults ages 60 and older to examine the relations of subclinical cardiovascular disease to brain and the cognitive function in older people. So those are the variables. And then we can say the potential mediators include the brain-related pathology. So here, the potential mediator is a brain variable that is a total green material volume transferred. So we would like to look at the relationship with this mediator. And here we can the age, just like the predicted variable, and then with others. So we can get the independent variable through pass A, and also we can get through pass C to examine the mediation. We run the regression analysis for each cognitive variable. The cognitive variable is the dependent variable to search the potential mediation effect from the brain variable. And then we will get this third analysis so that we can figure out the mediation analysis. So this the effect tests and the corresponding results. Here we can see first the effect tests with p-value 0.08, 0.09, and 0.07. Those p-value just around 0.05, not significant, but pretty close. So also we can see the proportion of total effect that is mediated, about 43, and the ratio of indirect to direct effect, and the ratio of total to direct effects. So we can figure out the mediated effect or indirect effect. This is about 24%, and the direct effect is 33%, and we have the total effect is 57%. And we have the results. So we can conclude that there is a very likely mediator effect, because this data set is pretty small and just a preliminary with p-value around 0.07 or 0.08. So we would like to see maybe likely mediator effect for the total green matter volume transformed in the relationship between age and the outcomes adjusted by other variables. So this is the first example I'm going to talk about now. We can also see the proportion and the ratio of effects. Next, I'm going to talk about another study I practiced for many years. If you are in our Irish pretty long time, you are quite familiar with this project. This is called the Courage. This is a randomized trial evaluating the outcome of optimal medical therapy with or without PCI in a total of 2,287 patients with stable coronary disease conducted between about 20 years ago at the US and Canada. And the treatment is PCI with optimal medical therapy versus optimal medical therapy alone. And the outcome is about the cardiovascular events. The main results from the Courage has shown that among patients with stable coronary artery disease, PCI strategies did not show a significant effect on the reducing the risk of death, MI, and other cardiovascular events. The study also showed that adding PCI to optimal medical therapy was more expensive than optimal medical therapy alone and not cost effective. Another important secondary outcome is about the quality of life. PCI with OMT was demonstrated to temporarily improve angina control as compared with optimal medical therapy alone. So we would like to see the patients in both groups, if has the significant increase in benefit in terms of quality of life. So the main reason, so like for the benefits in quality of life, like to say, if the potential mediators, the fundamental issue is that if the improvement in quality of life just due to the PCI or due to other potential mediators, specifically due to some medications. To measure quality of life in this study, we used two instruments. The one is Seattle Angina Questionnaire, another is Rwanda 36 at the baseline and 1, 3, 6, and 12 months, and followed by annual evaluation. The health status related to angina assessed by the patients by using Seattle Angina Questionnaire. Another is measured by Rwanda 36. The angina related quality of life measured by Seattle Questionnaire SEC use 19-item questionnaire, 5 domains: physical limitation, angina stability, angina frequency, treatment satisfaction, and quality of life. After many years, we found that it's not necessary to use all 5 domains. We can only use like domain 1, 3rd, and 5th. So we will focus on the physical limitation, angina frequency, and quality of life. Another is Rwanda 36 has 8 domains: physical functioning, role limitation, physical, and so on. So we would like to say the optimal medical therapy is medication, and then the medication class consists of different medications, including like ACE and beta blocker and non-actin nitrate. So in my study, I focus on the CC blocker and non-actin nitrate. If the improvement in quality of life, like most rely on the CC blockers and non-actin nitrate, instead of mainly depends upon like the treatment. So first, I look at if calcium channel blocker, CC blocker, is like a mediator for physical capacity insect for the physical limitation. So I look at the relationship between the PCI as the treatment, the CC blocker like a mediator, and the physical limitation as the outcome. So I run the analysis, and then we find that the mediation effects based upon the Sobel-Goldman mediation tests are all significant, which means the CC blocker was likely a important mediator. And then this is the results from the R package to run this analysis. And here we can see the physical limitation and also the mediator. We run the analysis. So we find that for the average quasi-mediation effect, this is significant, but for the ADE and the total effect are not significant. So this is very important because we can see even though overall the mediator effect is significant, but if we decompose it into different parts, we will see for ACME is significant, but for ADE and the total effect are not significant. So this is the reason we need to look at the effect overall and also for the different components. If we use this plus of effects, that also show from here we can see the effect ACME is significant, does not cross the 9-0, but for ADE and the total effect across 0 instead of not statistically significant. when we conduct analysis, we can, before I use the stat, and now I use the R to conduct the mediation test. We can see the overall, the sample test is significant. So we compare the results to the results from this data. We can see the results are pretty close, but we can see from the plot and from this results, we can see which part is significant and which part is not. So also we can look at if there is interaction between treatment and mediator. This is a very important step because we need to evaluate if the impact from mediator has some interaction with treatment. So after we conduct the interaction test, we can find from the p-value 0.86 the interaction is not significant. So this is for the physical limitation. And now let's move on to the angina frequency, because in this study, angina frequency is not only the important component for quality of life, but also statistically we will see for the angina frequency, we can use both continuous outcome and categorical outcome. Because we have not only angina frequency, we have the clinical consideration for angina-free. For angina frequency, here we use continuous variable, and we find that the Sobel test and the Goodman test, the p-value is about 0.02, 0.02, and 0.16. We can see the significant difference for the mediation effect. So we can conclude the C3 blocker is a very important mediator for angina frequency. And also, if we convert the angina frequency to clinically angina-free or not, which means angina-free is a categorical variable, we can see the results, and then we still show the cis blocker is a complete mediator for angina-free. So, and here we can see that if we further decomposite the mediation effect into like ACME, ADE, and the total effect. Okay, as a reminder, ACME stands for the average causal mediation effects, and the ADE stands for the average direct effects. We can see that for the control, for the ACME is significant for control, but not for treated. So, and also we can see when we take a look at the categorical outcome angina-free, we have the similar results. Now we can conduct the mediation effect test. If we compare the results from R and from data, we can see the results are pretty close, and we can conclude the mediation effect significant. And also we can look at the interaction between the treatment and the mediator. Here we can see the interaction test, the p-value is 0.09 and 0.18. We can conclude that there is no evidence to show the interaction between treatment and mediator. And here now we can see that overall, the C3 blocker was like a mediator. I would like to say complete mediator, which means significant in three terms for the mediation analysis, including ACME, the average causal mediation effects, the average direct effects, and the total effects. So these plots show the cis blocker was like a complete mediator for angina-free and also for angina frequency. Further, we can look at the cis block like a mediator for quality of life. This is for for the fifth domain. And first, we look at the Sorber test and the Goldman test. These results from that, we can see all of p-value less than 0.05, indicating the significant mediation effects for cis blocker as a mediator for quality of life. And okay, so here we can see the ACME is significant, but for ADE is not significant. For total effect is significant. So for total effect is significant. So now we know the cis block in what component is significant and in which component are not significant. So this is like basically for us to look at the outcomes. We conducted the mediation test. The results similar to those from STATA program, and also we test for the interaction. We find that there is no significant interaction between the cis blocker and the treatment. So after conducting the analysis, including like mediation test and the interaction test, we can conclude that cis blocker can be like a very important mediator for the quality of life, which means the PCI as a very expensive procedure for the cardiovascular disease among patients with stable coronary disease not only didn't improve the clinical benefits, but also didn't improve the quality of life. The improvement or benefit in quality of life major due to some medications such as like CC blockers instead of like the very expensive and unnecessary procedure PCI. So those results have had a very important impact in the practice, not only in the United States, but also worldwide. So this is one of the reasons worldwide recently, the number of PCI procedures has significantly decreased among patients with stable coronary disease. And also in recent years, some other important clinical trials further illustrate the results from courage. And here we can say the mediation analysis can be like very important to figure out the impact from which part in medical research, like from the treatment PCI or from like a medical related therapy. And here, this is like show the mediator cis blocker for the quality of life. As we can see, they have a significant impact on like ACME and the total effects, but the ADE, which means the average direct effect, are not so important. So we look at one medication, cis blocker. If we look at another medication, this is another important medication for the study is the non-actin nitrate. Was also like a complete mediator for angina frequency, because among physical limitation, angina frequency and quality of life, angina frequency is considered as the most important factor for the quality of life. See here, we can see the Sorber the test, the p-value less than 0.05. So now so far we see the CC blocker and the non-actin nitrate both are the important mediators for quality of life when we consider like the treatment PCI and the quality of life. Therefore, we should consider two mediators. So here we have a CC blocker as the mediator 1, and we have long-acting nitrate as mediator 2, so that we will look at like the treatment as a PCI plus PCI as a treatment through the 2 mediators, CC block and non-active nitrate, to impact the quality of life in terms of physical limitations, angina frequency, and the quality of life. In that case, we need to conduct the further complicated mediation analysis, which means we will have the 2 mediator analysis. That will be another important topic for our tech talk. But today I'm just like to show how we can use like R to conduct like 2 mediator analysis or multiple mediator analysis. In R here, we can use a R package and another one to do it. And then we will specify the 2 mediators like here, M1 and M2. And then we can use the multiple mediation function by forming the NOVA package to conduct the 2 mediator analysis. And then we will get the 2 mediator analysis in R. This framework and this step-by-step things are complicated. So today I don't have enough time to talk about it, but we can see the results and to show the M1 as a CC blocker, the M2 as a non-acting nitrate. See the p-value, we can see less than 0.005. We can conclude that the 2 mediators are significantly impact the outcome for the quality of life. So this is the way for us how to conduct the multi-mediator analysis. So today, I would like to conclude our presentation about mediation analysis. Because mediation analysis can be used in many medical studies. Like so today I talk about the model-based approach. We were estimating causal mediation effects, and we will conduct like a sensitivity analysis for look at like the different impact. And another type is the design-based approach. That is another topic. Also, I would like to point out many statistical software such as like R, CS, Data, and others can be used to conduct the causal mediation analysis. But of course, different software have like the different advantages. So in practice, we quite often need to combine the advantages from the different software. Okay, that's my presentation for the introduction to mediation analysis.
Thank you, Zugui. That was a great presentation. We have about 10 minutes for any questions. I have a question for you. In your experience, how often do you feel like people think about mediation either before doing the analysis or actually in the design of the study? Or is it something that people typically think about kind of afterwards, once there isn't maybe a main causal effect and they're thinking about why or how an exposure impacts an outcome, and then they think about mediation afterwards? Do you feel like it's better to think about it ahead of time, or in most cases do people sort of think about it after the fact?
I think in recent years, more and more investigators like to think about ahead when they do like their study design. For example, recently there are like a cardiologist who are interested in like the social determinants and the hypertension incidence. So when they consider like social determinants, they are not all like the poverty degree and the others, and they have some hypothesis about how the social determinants impact the incidence rate of like hypertension in case. Case means under age of 18. So they think maybe if we look at the incidence rate of hypertension and the social determinants, they definitely should throw some mediators. For example, the social determinants factors could have very important impact on BMI for case. So they think like BMI could be the very important mediators, because it seems like BMI definitely impacted the incidence rate of hypertension, and the social determinants impacted the BMI. So in several studies, the investigators think that we should think of this mediator earlier, because it seems like this is very obviously, but for a long time, not like many people pay close attention to BMI as a mediator. So I think this is, I think this is a very example. So for example, one investigator like to use the when the index is called the a neighborhood
deprivation index.
Yeah, index. That index definitely impacted BMI, and the BMI impacted the incidence of hypertension. So before they didn't like pay close attention or like they examine the impact of BMI on like the incidence rate of hypertension. So I think the mediation analysis is that for us to identify some very important factor that like a bridge between the treatment to the outcome, specifically for some like behavior studies. For maybe I have some procedures. For example, like the social determinants of health can be considered part of behavior studies, because social determinants not like so important or like so be studied by investigators before, because but social determinants, we would like to say for long time can be considered not directly impact the clinical outcome, but always throw a third or bridge to impact the clinical outcome. For example, social determinants impact BMI. BMI as a mediator, I consider that mediator can be considered like a very important bridge. Yeah, the purpose of mediation is to identify the importance and the impact of the bridge. So to my understanding and my experience, and in recent years, the people are more and more pay close attention to the bridge or the mediation analysis. So this is my experience.
There's a question in the chat from Dr. Chen. Are there restrictive assumptions on the independent or dependent variable with respect to the shape of the variable? Like it has to be continuous or normally distributed?
Okay, not necessary. Okay, let me talk it one by one. For the outcomes, as I said, it can be continuous, can be categorical, or can be like survival data. So it's not necessary. But we should be careful. If we use the outcome not like continuous or not like normally distributed, we should use the different models, such as like the binomial or Poisson regression or others. Another important is about the mediator. Mediator could be continuous, could be categorical. For example, this is the reason why I talked about the angina-free. Angina-free is a categorical variable, but angina frequency is a continuous variable. I purposely talk about this example is to illustrate that for those either outcomes or mediators is pretty open. When I say open means can be continuous, can be normal, can be like categorical or other type. But when we do it, which means for these three equations, could be any type. Yeah, could be any type. But for the different type, we should use the corresponding appropriate model to handle the models.
Thanks, Zugui. There's one more question in the chat. How do you easily distinguish a mediator from a confounder?
Okay, this is a very good question. A mediator and a confounder, there are some, generally speaking, is that the mediator is like a bridge, I said. So you can identify the mediator is like related to the outcome, but for the other variables, generally speaking, has nothing to do with like the mediator. Yeah, so in some articles, they have a mathematically solid properties to say some like the perpendicular. Perpendicular is another terminology for independence.
Yeah, and so from my epidemiology brain, a confounder is not in the causal pathway. That's what defines a confounder.
Yes.
A mediator, you're actually in the causal pathway. You're explaining, right?
Yeah. This is the another way to differentiate the mediator and the other confounders, risk factors.
I'm going to take the last minute. Oh, go ahead.
Sorry, quick question. So are you saying that like confounder, for example, it can change from one study to the other depending on the question? Is it the same thing with mediator?
Should be different, or like for the multiple mediation analysis, which means if you identify several mediators, you should like separate it. And then do not statistically like you put the function, the variables in the model, but you are separate because we have the model. I think the model 2 is specifically for the mediator regress on other variables.
Oh, wow.
Yeah.
Thank you.
Yeah. Otherwise, you will be redundant.
Right.
Yeah, I think that's great and great question. It's just so important to think about how your variables are related to each other and the theory, either biological, social, psychological theory on how your variables are connected. Because in one analysis, a variable can be a mediator, in another it can be a moderator, in another it can be a confounder.
Yeah, so this is one of the reasons some articles recommended that if you are not sure, we can do like a component analysis to have the perpendicular or like the factors, so that to eliminate like the correlation. Yeah.
Awesome. All right, it is 1:01. I like you, Zugui, could talk about confounding mediation all afternoon. But our talk is over. That was an excellent talk. Thank you so much. I saw in the chat a few people ask for the slides for the presentation. So we'll talk to you, Zugui, after to see if we'll be able to send that out. Thank you again, everyone. And thank you very much, Zugui, for giving this talk this afternoon.
Okay.
Thanks.
Thank you.